I've said it many times, I know I would change my ways, I know for sure. When all the crows decide to meet, they settle down beneath my feet. I've got it right and I got it wrong, but I learned my lesson hanging on. Come sit here with me by the fire and let it go for a little while.
Today I'm going to take a look at some of the core nursing values which we uphold. These are the deep-set values that attracted us to nursing and keep us coming to work, and they make us return after those bad days. Some of these values may have been with us from an early age. We might have picked them up from our parents, family members, or friends. We may have developed these values as we progressed as a nurse. As a developing nurse, we inadvertently watch and mimic the values and qualities we see in our colleagues and peers. Though we may not be consciously aware of it, we inherit their values as we work with them. And likewise, our actions and practices have the ability to impact the core values of those around us. So today we will start to examine these 6 core values of what it is to be a nurse in the NHS today. To be a nurse, we care, have compassion, competence, and communication, and it's at the heart of what it is to be a nurse. We nurse with courage and commitment in everything we do. So today we will have a look at the core value of communication. Communication is not a personal value in itself, but the desire to form strong therapeutic relationships through respect, compassion, and care is at the heart of what it is to be a great nurse. The art of truly listening and hearing our patients allows us to meet their holistic needs and advocate effectively. Sometimes communication is non-verbal. An offer of a cup of tea can signify understanding and care. Likewise, listening and time goes a long way for a struggling doctor or a nurse. Communication is not always about the person who is the most confident and able to shout the loudest. The best communications is often from the well-balanced, calm person who is able to listen, sit back and evaluate situations, then act accordingly. With communication, action often speaks louder than words. It is not always what the person is saying that tells the true story. I once worked with a nurse who was the nicest, warmest person I'd ever met. She inspired me with her bedside manner and the way she supported her colleagues by teaching them. I felt like I had a deep trust in her. One day, when I was working with her in resource, with a red standby, she was supporting a junior nurse by teaching her to take blood cultures. After finishing, she came out of the cubicle and remarked how stupid the nurse was. How could she not know how to take cultures? I was shocked. She appeared to be the supportive and genuine nurse, but her actions towards the nurse showed the opposite. It led to me to question all the other interaction I'd had with her, and I could no longer trust her. We must ensure that our actions align with our core values. Communication in the emergency department is at the centre of an effective and safe environment. Many failing CQC inspections show poor communication as the biggest area of concern. Clear verbal communication with our colleagues reduces errors, improves efficiency, and reduces stress. An example of this is when nursing in the majors area, which is often the busiest in terms of sheer volume of patients. Taking charge of the care of the patients in your assigned cubicles, then communicating effectively with the coordinator and doctors improves the care for the patient and the flow of the department. For example, does your patient need analgesia? An x-ray, personal care? Does the doctor know that there are social issues? Your patient is only awaiting blood results. Well, has the coordinator asked if a short-term wait is possible? Furthermore, we can prevent many complications and complaints by having strong communication skills. with our patients. Many of the complaints received by PALS each year are failures in communication issues. Try to always keep your patients informed, even if you don't actually have a plan for them yet, or if they haven't been seen by a doctor. For example, in today's emergency departments, wait to be seen times can often be in excess of 4 hours. For patients who do not visit an emergency department often, their expectations are massively unrealistic in terms of waiting times. Communicating with your patients at every interaction is often helpful. For example, when going to take a set of observations, say to your patient, "Hi, my name is. How are you? I believe you are just waiting to see a doctor at the moment. Unfortunately, we have a very long wait time today due to a lot of very poorly patients. Our doctors are working very hard and we have all your details on screen. Please let me know if you need anything whilst you wait." Obviously, many people will still be unhappy with the wait time, but you will have eased any anxiety of not knowing what is going on by doing this. We are taught early on the importance of documentation in nursing, but how can we make it work for us and make our lives easier? Busy doctors in the emergency department often fail to communicate patient plans to us as nurses. However, where they lack in verbal communication, they often make up for in their notes. Try to check the doctor's notes regularly to see if the patient's plan has been updated. Likewise, document any test results, complications, or findings from your assessments to assist with the doctor's care. Our documentation is the one thing that will support us should the worst happen and a complaint is made against us or the department. Document not only what you did for the patient, but also what you didn't. For example, did the patient decline a drink or analgesia? Did you have to nurse them on the corridor due to the department volume? Our documentation is also one of the best ways we can communicate once our patients are no longer in our care. Once the ward nurse takes over, she can use your notes to see how the patient mobilises, if they are nil by mouth, and is there any outstanding care. Use transfer documentation in those patients with many outstanding care needs. It helps the next nurse make the patient safe and it covers you if anything goes wrong.
Now always in your head